Good day and welcome. My name is Dr. Richard Cowin. I am the Director of the Laser Foot Surgery Specialist in Orlando, Florida, and I'm very delighted to be working with PlacidWay to do a presentation regarding minimally invasive foot surgery today. As you can see, my office is located on Sand Lake Road in Orlando, Florida, and again, I work with PlacidWay as one of their specialty surgeons in the field of minimally invasive and laser surgery, and today we're going to focus primarily on minimally invasive surgery. What is it? Well, minimally invasive foot surgery is a relatively new way of correcting foot problems in which the skin incision is usually less than 1/8 of an inch in length, and it's really only large enough for me to introduce special instruments into the offending area of the foot. You see some pictures on the slide of some of the more common foot problems that can be treated with minimally invasive surgery. The first one being bunions, the next one being hammertoes, which is the most common cause of corns on the toes. The third one is calluses, which are usually caused by declined or displaced metatarsal bones, which I'll talk about during this lecture. The next, of course, is Taylor's bunions, which are the same thing as bunions, but they're on the little toe side rather than the big toe side. The next is heel pain, and you see a picture of a diagram with a heel spur, a very common cause of heel pain. And then the last are soft corns, which are corns in between the toes rather than being on top of the toes. The benefits of minimally invasive surgery are that, first of all, it can be performed in an office setting rather than a surgery center or a hospital. The next is that when minimally invasive surgery is performed, generally no hardware of any type, such as pins, wires, or screws or implants, are necessary. And the third benefit is that when the procedure is performed, patients actually walk out of our office on a treated foot immediately after. Here is one of the more common problems that we treat with minimally invasive surgery. This patient has a fairly severe bunion. Notice that in addition to the large bump that I'm pointing to with the laser pointer, that the patient's big toe is angulated inward too far, and as a result, the second toe has become a hammer toe. This is because the big toe has moved over so far as a result of the bunion that it really becomes a situation like trying to park 5 cars in 4 parking spaces, and there simply isn't enough room. Traditional surgery for this would likely involve making large incisions both in the area of the pointer and on the second toe as well as the first toe. And with minimally invasive surgery, we can actually correct this type of problem by making 3 1/8-inch incisions, one here, and one at the base of the second toe. Very mild bunions are bunions in which the first metatarsal that I'm pointing to now is not severely dislocated. And in these cases, very simply, the shaded area that's shown on the slide can easily be removed. The next slide is showing a case where this procedure was used incorrectly. In other words, this bunion was more severe than the allowable range for just removing the bump. You can see the long scar that the patient had, and all that was done through that large incision on both the left and the right foot is that the bump area was removed. This patient should have had a slightly more aggressive procedure, which also could have been done minimally invasively. Fortunately, we are often able to do additional or revision surgery to correct a situation like this in our office. A more moderate bunion is one in which there is more dislocation of this bone, which is called the first metatarsal, and as well, usually the big toe is moved inward somewhat. In this case, in addition to removing the bump area, we would make a tiny cut across the first metatarsal bone and we would move the end of the bone inward closer to the second metatarsal. This can all be done through a single 1/8 of an inch incision with just one stitch, and unlike what the picture is showing the screw here, this can be performed minimally invasively without the screw insertion. Next is a more severe bunion, and again, the way we measure the severity of bunions is bunions are not really bumps, they are really dislocated bones. So the way we measure the severity of a bunion is by drawing a straight line down the second metatarsal, a straight line down the first metatarsal, and they will of course form an angle. The larger the angle, the more severe the bunion. So in this case, this patient would certainly need to have a little cut made across the metatarsal bone here, would need to have the bump removed, and would also likely have to have a little wedge or pie-shaped cut in the first bone of the big toe in order to move this toe over straight. Again, this can all be done minimal invasively in an office setting. There would usually be one stitch in this area, one stitch in this area, and the patient would be able to walk right out of the office afterward. I'm often asked when people come into the office and have a large lump around the big toe joint, what else can look like a bunion but not be a bunion? And the answer is an arthritic joint can resemble a bunion but not be a bunion. When you develop an arthritic big toe joint, what happens is the cartilage in this area actually wears away and bone rubs on bone, and as a result, excessive bone growth forms on both the first bone in the big toe and on the end of the metatarsal bone. We have a wonderful minimally invasive one-stitch procedure that was developed in Italy called the Valenti Arthroplasty procedure. And through this very small incision, we can remodel all of the excessive bone growth around the end of the first metatarsal and the base of the first toe in order to give the person good movement back in their big toe joint and in order to remove the bumps that are rubbing on their shoes. Many doctors around the world like to utilize joint implants, either a titanium implant or a silastic implant or a combination of the two to insert this in the big toe joint. This is a fairly large operation to perform. I find that it has a long recovery, and I also find that these implant insertion procedures are laden with many, many potential complications. So we very much prefer the Valenti arthroplasty procedure that I just described to the insertion of joint implants. Another common problem that we are able to treat minimal invasively is that of heel pain. And the first phase of heel pain usually is called plantar fasciitis. This soft tissue structure that I'm pointing to is the plantar fascia. It inserts into the calcaneus, which is the heel bone, and very often this will be inflamed in this area, causing heel pain, particularly when the patient first gets up after they've been sleeping or sitting for a while. Minimal invasively, through a very small incision on the side of the heel, we can actually partially cut the plantar fascia, and new fascia will actually grow in and restore it to its original strength, and will also, in many cases, avoid the heel pain. A more severe type of heel pain is when there is actually a heel spur present on the heel bone, and in this case, we can actually remove the heel spur minimal invasively. Here you see where there was a spur present on the bottom of the calcaneus or heel bone. The heel spur has been removed, and a portion of the plantar fascia remains intact. This is also a procedure where the patient can walk right out of the office. Another common problem is called a midfoot joint spur. This would be on the top of the arch area of the foot, and the most common cause of this is, again, arthritis. You can see the spurs present here on the midfoot area, And again, through a 1/8 of an inch incision with just one stitch, we're able to remove these midfoot spurs. Hammertoes are quite a common problem. You can see the curvature of the toes at the first joint. Hammertoes come in various severities like other foot problems, but the problem that usually brings people with hammertoes into our office is the formation of a corn on the top of the first joint, and very often there will also be a callus on the end of the toe. Through a very small incision, we can remove a part of the joint, and in some cases, we can even correct a hammertoe by working back in the bone so we don't even have to remove the joint. We can very often lengthen the tendons on the top and bottom of the toe and straighten out the toe beautifully without removing the joint. So it really depends on the severity of the toe and whether it's rigid, semi-rigid, or a flexible hammertoe. In any case, no pins, wires, screws necessary, just a gauze and tape bandage, a small surgical shoe that I'll show you shortly, and the patients can walk right out of the office. When traditional foot surgery is performed for hammertoes, and in this case for Taylor's bunion, you can see the lengthy and unsightly incisions on the toes, and you can see the pins sticking out of the ends of the toes, which will later be removed. Again, in my experience, these pins are not necessary when minimally invasive surgery is performed. A complication of the pins that I have found is when you have a pin sticking out of a toe, you actually have a communication vehicle between a fairly non-sterile external environment and hopefully a sterile internal environment. And a fairly well-known complication of this is when bacteria actually travel down the pin and right into the toe, causing what is called a pin track infection. Again, with minimally invasive surgery, since we're not using pins, pin track infections are not a possible complication. This is an example of traditional foot surgery for a bunion, and this is a patient that came to us after he underwent surgery, and you can see that this is a fairly moderate bunion. The big toe isn't too crooked, and the way that this was corrected was by making several cuts in the bone and by inserting a plate and 1, 2, 3, 4, 5 screws. And this patient was in a cast for quite a long time, was crutch walking for quite a long period of time, and we were able to do his other foot minimal invasively with a 1-stitch incision and having him walk out of the office. So all of these screws and plates and the like are not usually necessary at all when minimally invasive surgery is performed. Another common problem, I spoke earlier about soft corns, which are corns in between the toes, and here you have a bone spur on the little toe, and you can see one on the 4th toe as well, and this is a problem that can easily be permanently corrected by smoothing down the bone here and here, and the corn will actually disappear. Corns and calluses are not actually skin problems. They are actually skin manifestations of bone problems. Once the bone problem is identified and corrected, the corn or callus usually disappears permanently. Calluses are areas of hard skin on the bottom of the foot, where corns are areas of hard skin either on the toes or between the toes. And in this case, one of the metatarsal bones, the second bone, is down lower than that of the 1st, 3rd, 4th, and 5th metatarsals. So every time this person takes a step, they bear extra weight in this area, and a callus forms. Here's another depiction of that, where this would be the 1st metatarsal bone. This would be the second one that we just looked at, and you can see how this is down lower than these bones. This person would likely have a callus in this area. We can, through a 1/8 inch incision on the top of the foot, make a small cut in the 2nd metatarsal bone and actually lift it up and put it in proper alignment with the other metatarsals, which would not only eliminate the pain, but it would also allow the callus to disappear. Again, when minimally invasive surgery is performed, the screw is not necessary. This is a picture of a surgical shoe, which is what patients are able to walk out in right after the procedure is performed, and it's usually performed under just a local anesthetic. The patients are given a surgical shoe, and depending on the amount of surgery that they have undergone, they will normally wear a surgical shoe between 1 and 3 weeks. In addition to the surgical shoe, we provide our patients with a shower boot so they can shower immediately after the surgery and keep their dressing dry. If you have any questions about minimally invasive foot surgery, it would be my pleasure to answer them. Please contact your expert representative at PlacidWay, and they will put you in contact with me, and we can either speak on the telephone or via email, etc. I'd be happy to answer any questions that you have. Thank you again for your interest, and I wish you good health.